December 2021, more than 800,000 people had died as a result of COVID-19. That's just here in the United States. Joining us now, Dr. Amesh Adalja, an infectious disease specialist and senior scholar at Johns Hopkins Center for Health Security. Doctor, long time no see. Good morning.
Good morning. Thanks for having me.
Of course, anytime. So while many Americans believe the COVID vaccine helped us get back to normal, there's no denying the rapid development of the vaccines, the subsequent rollout fed into vaccine hesitancy. How could vaccine education been handled better here?
Well, I think the first thing is the fact that the vaccine was something of, one of the greatest scientific achievements in modern history. To have a vaccine for a virus that wasn't even known to humans before December 2019, in less than a year, that's really, I think, a tremendous acclamation of how really science and medicine have advanced. However, that's a feature. The speed of the mRNA vaccines is a feature, but it got seen as a bug by many people, that this was something that made them vaccine hesitant. And I think it would have been important, and it is important, to really recognize the fact that even though this was the fastest vaccination on record, the lead up to it, the decades of work on mRNA vaccine technology had really proved that this was a safe and effective technology. And I think many people didn't understand the fact that there had been a quest to develop mRNA vaccines reaching back at least until the 1990s or even further. And that wasn't part of the discussion. I think not because it was deliberately left out. I think just people weren't really giving the scientific context for what these vaccines really represented. And remember, the anti-vaccine movement was poised to jump. Even if this would have taken 2 years, they would have attacked it. And they've attacked every vaccine that we've developed, even if it's been something that's taken years to develop, like, for example, the HPV vaccines, like Gardasil. They've attacked those, even though they don't have that same timeline as the COVID-19 vaccines.
We know of instances of long COVID in many vaccine recipients. I want to talk about a recent study. It details what's being referred to as post-vaccination syndrome. There were serious side effects, including biological changes that are now being linked to the COVID-19 vaccine. You and I spoke almost weekly during COVID. In hindsight, some are very frustrated that more wasn't done to fully test these vaccines before they were made widely available, or the risk wasn't communicated better. What are your thoughts on that, especially now knowing a lot of these mRNA vaccines were being worked on since the 1990s, to your point?
Well, I don't think that this study that you're referencing is something that really changes the equation. Remember, this is a study it's a preprint. It hasn't gone through peer review. And I think there's been a lot of questions regarding the methodology to make sure that they're actually seeing a real signal here. But this is something that doesn't make complete biological sense. So I think it's really important to drill into this. But the side effects, as side effects were announced or were discovered, for example, myocarditis in adolescent males, that was something that became very well known, as well as the Johnson & Johnson vaccine and the clotting issues that happened there. That became very well known, and they actually paused that. So I don't necessarily think that there's been some kind of cover up of vaccine side effects. I think if you look at, on balance, what this vaccine has done, it's saved millions and millions of lives, and the side effects are very minimal in that sense. But every vaccine has side effects. Every vaccine has a risk benefit analysis you have to go through, and on balance, especially for high risk people, these vaccines are life saving.
Doctor, you are well respected in your field. We are now seeing a massive measles outbreak, nearly 230 cases in West Texas, New Mexico this year. 2 people have already died. What should health experts and the general public be doing right now to get in front of this?
The thing is, the solution to the measles outbreaks that we're seeing now and the ones that we've seen in years past has been the same solution since the 1960s. It is to have a very high vaccination rate. And when you look at where this is occurring, in counties like Gaines County in Texas, the vaccination rates are extremely low. And this is the most contagious infectious disease known to humans. So if that vaccination rate is below 95%, outbreaks are going to occur. So the best thing that can happen is individuals who are not vaccinated need to get vaccinated. That's what's going to put an end to this outbreak. And I think this is kind of exactly what you would expect when vaccination rates fall. And measles is kind of the canary in the coal mine. It is the first infectious disease that kind of roars back when vaccination rates fall because it's so contagious. So it is the vaccine that is the solution to what's going on in Texas and in New Mexico.
I want to ask you about some news that came out late last night. The CDC is now planning to investigate links between vaccines and autism. You and I know there have been dozens of studies. It's never found a link. Are you concerned this will create more vaccine skepticism?
Yes, this is something that has been disproven. It was a false, fabricated study that has been living on now for decades, even though it's completely false. And trying to keep disproving this wastes a lot of resources. This is going to cost millions and millions of dollars. And it also puts doubt in people's minds that this link has not been completely disputed. So no, I think this is a horrible decision. I think it's going to add to more vaccine hesitancy, and it's going to divert resources away from important studies that would actually help elucidate what actually is behind autism. And we know it's not vaccines, but they keep looking there. And it's like I've heard before. It's like trying to prove that the world is round multiple times. This has already been done.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.